So when we're pregnant, our pelvic floor takes a lot, takes a lot of downward pressure. And you've all probably heard of Kegels, and Kegels are sort of a way to strengthen the pelvic floor so that after we have our baby, we don't leak when we cough or sneeze or laugh or whatever. There is some controversy around whether we should do Kegels when we're pregnant, because if we're trying to get everything to be able to open up easily during labor, then why are we tightening those muscles? And so my answer would be that we're not just strengthening, we're also creating more flexibility. And B, a weak muscle isn't necessarily an open muscle. So we want to use our Kegel the same way we would do a bicep lift, like a, resistance training. So you're gonna lift to create all this strength here, and then you're gonna slowly release. I think it's eccentric contraction, so that your muscle actually gets longer. And we are going to do the same thing with our Kegels. We're going to draw in so the muscle contracts, and then we're going to practice expanding and lengthening those muscles. So we're not just letting them go, but we're actually lengthening them. All right, so how do we do all this? Let's try it. So first, we want to contract on the exhale. And the reason is that this kind of matches what's happening with our diaphragm. As we exhale, our diaphragm lifts and draws in to be able to push the breath out. And as we inhale, it goes down and it expands. So same thing with our pelvic floor. So as you exhale, draw that pelvic floor in and up. And as you inhale, expand down, broadening the sit bones behind you. And so this is actually moving your pelvic floor into alignment, which is, we tend to tuck under, so it tends to be too far forward. So we move those inner thighs back and then broaden those sit bones back and apart. And then on the exhale, we draw it in again. So let's do one more of those. Inhale. You can even think of it almost like a pelvic tilt. So you're tilting your pelvis, you're broadening your sit bones behind you, and then you're keeping as much of that tilt as you can as you exhale, and you draw that pelvic floor in and up. So let's try elevator Kegels. So on your inhale, take those sitting bones back and apart. And on your exhale, gently draw the pelvic floor in and up to your belly button and pause. Take a deep breath in, widening out, but see if you can keep the tone. And then exhale, draw it in a little higher. Now, if you're pregnant, this may be about all you want to go to. So we don't want to reduce the space for baby, and we can't help but sucking the belly in. But if you are a mom or just anyone who wants to connect to your core power, 2 more, exhaling, drawing it even higher, picturing your pelvic floor going all the way up to your low ribs. And then on your last exhale, all the way up as high as you can, even picturing it going up to your heart. Obviously, it is not, but you're really using a lot of muscles to go there. And on your inhale, you're going to go back down. So on your inhale, you're broadening the sitting bones behind you. And even think of like pressing down through the sitting bones and your tailbone so that you feel like you're grounded. And that's your elevator Kegels. So when can you do these Kegels? honestly, anytime people say, well, when you stop at a red light, when you brush your teeth, and it's nice if you can find a trigger, but generally, whenever you think of it, just take that nice in breath and broaden out. And then on your exhale, draw your pelvic floor in. And as you lift, you'll get more power so you can move down again.